So I'm going to go ahead and welcome Ms. Tiffany Ross. Thank you.
Of course. Do I just talking to the mic, pull it up, lift it? What? All right, testing, testing. Good evening, everyone. So I was given, you know my name, Tiffany Ross, RUHS Behavioral Health. I've been here for 21 years with our department. Yeah, a long time, 21 years. And doing the clinical work, working with families, working with parents. So I started working with parents in CalWorks. And so started there, then worked as a trainer in an administrative unit, and then did crisis intervention, still do crisis intervention training for law enforcement throughout Riverside County, providing mental health education to those first responders, and now a supervisor for a little over 3 years now with the community behavioral assessment teams known as CBAT. And yeah, it's been a journey here with the county, and the family advocate, they've been huge advocates, just really proactive and in there and really helping families. And so to start with the county, working with parents, and then to be doing these kind of things, it just all makes sense. It all makes sense, and it does take a village, and it takes all of us to have some understanding and some education about what's going on. And I know this is a big issue. This is a really big issue. Anytime we bring law enforcement into the mix, that's because there's something going on that we feel like we need further assistance, we need support, we need strength, we need safety. We don't feel safe, and so we call law enforcement. And I know there's a lot that we could talk about, and we can go on and on about, just the tension in our world, in our society, community, and just the fractures in relationships, with law enforcement and our community, with our community and behavioral health. So our CBAT units are incredible to have two professionals from different cultures, from different trainings and perspectives, because their roles are very different. To have them united and working together is just awesome. It's awesome, and when done right, you guys have reaped the benefits of that. And so I'm very happy to be here, very fortunate to be a part of this program and supervisor over my outstanding staff. I love them. I care about them as I care about you. I always tell folks, I don't need to know you to care about you. I want everyone to be safe. I want everyone to be informed. I want everybody to feel strong and empowered to do what's right by them and for them. So, with that being said, let's talk about CBAT. And then Sharon will come up and she'll talk about her programs. And then after that, we'll open it up for questions. I did bring law enforcement on my CBAT units here because I think, if we're going to talk about law enforcement, then we should have law enforcement in the room to provide their perspective. And so I have two of my teams here, but you'll see as we go through through the slides, I have a lot of teams throughout Riverside County. We are expanding, we are growing, just like our mobile crisis response teams. We are expanding because we know the need is there, and we want to be able to get to families and individuals in a good amount of time, right? So let's get started. So crisis response types. So our crisis support system at CARE, we have 3 types of response teams. One, community behavioral assessment team, which again, I'll be talking about that. Our mobile crisis response teams, known as MCRT, and then our mobile crisis management teams. And Sharon will be talking about the number 2 and number 3. So CBAT. These are some pictures of my staff. Law enforcement, they're not my staff, but I call them my staff because, I try to take care of them too, and we all work together. But there's some good pictures here. Really outstanding folks. So what is CBAT? CBAT, and I'll put this up and then I'll talk about it. Okay. CBAT is a co-responder model. There's a lot of different crisis models. Some that use behavioral health professionals, some that use peers, some that there's a mixture, and then there's the co-responder model where we have a therapist partnered with law enforcement. And the CBAT response to 911 behavioral health crisis, calls involving 5150, substance abuse related, homeless related issues, really anything and everything. I guess, you could really say that any call that comes out to 911, there's some mental health related issue, right? People are in distress. They're sad, they're scared, they're angry, whatever the case may be. But specifically our CBAT units are to respond to behavioral health, mental health related calls to service. CBAT provides field-based risk assessments, linkage and referral, and follow-up as needed. So their primary role is to get out there as quickly as possible and do a risk assessment. Does the individual in crisis What are they suicidal? Are they homicidal? Are they gravely disabled? What is going on? Are they taking medication but no access to it, and as a result of that are symptomatic? Are they just distressed? Is there something going on in the home? Whatever the case may be, but our therapists are there to assess for risk and then determine what level of care. Linkage and referral, let me speak to that a little bit here. It is not just, these are specialized units. So it's not just about going out there and, okay, this person meets criteria, let's take them to the hospital. This person doesn't meet criteria, okay, here are some referrals. It's not that. They're a specialized unit that have the time to really work with those families or individuals to see what is the need. What are the factors causing the distress? And how can we best link this individual so that in the future, they're not having to call law enforcement at a later date, right? We want to prevent. Yes, we're there in the moment of crisis, but we want to prevent further crises from occurring. So what can we do? What kind of resources and information and education can we give to that individual and our family members who call, a reporting party who calls? What can we give them to really inform them of what's out there in the community? Because we have a lot of resources. We have a lot of resources. The challenge is not everybody knows about these resources. And so this is what I love about CBAT as first responders and our mobile crisis teams. As first responders, they may be the very first time that you hear this information, so they have to know this information. You may be hearing it for the very first time. You may not know that a primary care physician is not the one that you really want your loved one going to if they have a psychiatric impairment, that they should be seeing a psychiatrist, not a primary care. Some people don't know that. Some people don't know that there's a difference between a therapist and a psychiatrist. I'm not a psychiatrist, but because I'm a therapist, they think they're the same. They're not the same. A psychiatrist prescribes medication. A therapist, I can't prescribe medication. I cannot. But I can talk to you. I can talk to you about what's going on and let you know about, talk about coping and strategies, help you look within to see what's going on. In any case, sometimes people don't know this, and our CBAT teams do. And so to be able to provide that kind of education and maybe give family members in a community some aha moments is very valuable, because that can take you a long way where maybe you won't even think about going to ETS or emergency treatment services in Riverside, right? Maybe you'll know that there's another option instead of calling 911. That's what we want. So our primary goals of CBAT, another picture, I love pictures, is diversion. We're not a 5150 team. We don't go out there trying to put people on involuntary holds. Now, if they meet criteria, you bet, because we want to do what's in the best interest of keeping that person safe right now. And if doing that is what's going to keep that individual safe, then that's what we want to do. But really, our goal is to divert. Let's do everything we can possible to not have somebody go involuntarily. Let's see if they'll willingly go, because that's more powerful, right? Let's see if they have a safety network, they have a source of support, they have family, friends, somebody who can take care of them and keep them safe for now. What options do we have? Can we call the clinic? Can we see if maybe we can get them in right now? Can we take them to a mental health urgent care? All of these. Can we contact a family advocate who's working with this individual? Because we have access to looking to see if people are in our system already and already receiving services. And if they are, and if they're connected to a clinic or a therapist or a psychiatrist or a family advocate, why not call them and then say, hey, this is who we've made contact with this individual. Any suggestions, or can we get them in for an appointment? Whatever the case may be. So our goal is to divert. Divert from psychiatric inpatient hospitalization, divert from incarceration. Now, if somebody does end up being arrested because there is a crime, guess what we have in the jails, right? We have mental health staff. We have mental health staff, and each individual that goes into those jails is going to be assessed. And we can also contact the jail and let them know. We can call our colleagues within the jail and say, hey, we have so-and-so coming in, can you keep an eye on them? This is the information that we have. He told us that he was suicidal, so you may want to definitely keep an eye on this individual. So we could do these kind of things. We can contact our colleagues within the jail system, juvenile and adult. Because sometimes that's, unfortunately, sometimes that might be what's in the best interest of the individual, right? Yeah, but again, our goal is to divert, and divert from emergency departments as well. Our primary goals are a reduction in repeat law enforcement calls. Again, let's get individuals linked so they're not having to call law enforcement in the future. Let's inform you that there are other options other than 911. Appropriate linkage to care and resources, strengthen partnerships and a sense of unity between the community, law enforcement, and behavioral health. That's what I love. I love it all, but really to be able to build bridges, strengthen relationships, reduce stigma. There's stigma with mental illness, right? We know this. We know this. There's stigma with behavioral health and county employees, yeah? Not everybody thinks the best of county employees or behavioral health services. There's been individuals who've tried to access services and maybe didn't get the best care. And so when my teams go out, maybe they're more willing to talk to law enforcement, but they see clinical therapist on the vest and like, heck no, I'm not talking to you. You guys didn't help me. You know, I went and I tried to do this and all you guys wanted to do was that. So you have individuals who've had negative experiences as well with our behavioral health system, right? So we're trying to reduce that stigma, trying to represent for our department and our profession that we're here to help and we want what's in the best interest. In addition, the community and law enforcement, and the way that they see law enforcement. And if we have, you know, something happens negatively, it doesn't mean that one group of people or profession is bad. But it's very hard, though, when we've had negative experiences to be open-minded. But to have law enforcement and behavioral health come out together and give a different representation, a positive representation is just, it's wonderful. And we've seen the impact. We have seen the impact as a result of these teams going out. And that's something definitely we want to do, is strengthen relationships within our community. So how do you access CBAT? Now CBAT can only be accessed through 911 or non-emergency line. They are not a number, there's not a number that you can call. You can't call me and then I send them out. You have to call 911. So this is why it's so important, why I appreciate you having us here today, because oftentimes they get our programs confused and they don't know what's the difference. If you need law enforcement, because if there's a safety issue, if you need law enforcement, then you want to call 911 and you want to ask for a CBAT unit. Now, there might not be a CBAT unit available because I don't have them 24/7, and I have only one team for maybe one PD or one sheriff station. And that's something in the future I'm sure will expand. But sometimes there isn't a CBAT unit available because they're on a call. And so you'll have another primary field officer respond to the call. Nevertheless, it's always important, because I'm here teaching you about CBAT and how to access them, that if you were to have an emergency that required law enforcement intervention, then the way that you do that is you call 911 or the non-emergency line, okay? Because I'll ask, people will say, well, I think I need a CBAT team, like maybe a supervisor within our department will call and ask that question. And I'm like, okay, do you need law enforcement? Do you want law enforcement there, or is this a situation where you need a mental health crisis therapist or specialist? And they'll think about it like, yeah, no, we don't need law enforcement, we just need the crisis team. I'm like, okay, then you don't want CBAT then, because CBAT is when you need law enforcement there with the mental health expert or specialist. So the difference is that. So if you don't want that, then you call mobile crisis. If you do need law enforcement, then it's CBAT. And again, you'll have time to ask questions if you have any. So here we are, CBAT locations. Look at, there's a lot. There's a lot. Riverside PD, Hemet PD, Moreno Valley Sheriff, Temecula Sheriff, Paris Sheriff, Lake Elsinore Sheriff, Hemet Sheriff, Harupa Sheriff, Cabazon, Marietta PD, Menifee PD, Corona PD, Beaumont PD, Banning PD, Indio PD. The last three, Thermal Sheriff, Palm Desert, and Cathedral City, are all pending. I'm trying to recruit for those areas. So we really have expanded. We have a lot of different teams and a lot of support out there for our community and individuals and families. And that's it for CBAT. So we're going to hold the questions, and then we're going to let Sharon do her thing, and then afterwards we'll go ahead and open it up.